today's episode of She Has a PhD, the podcast where we celebrate extraordinary women in science. I'm Isabel Castanho, your host for today. Last week, Dr. Fiona Elwood, a leader in the field of neuroscience, shared her story and experiences with us. Today, she's back to have a short conversation on treatments for neurodegenerative diseases. Fiona, welcome back.
Thank you. It's great to be here.
For our listeners who may not be familiar with these concepts, could you please provide a brief overview of what neurodegenerative diseases are and how they affect the brain?
Absolutely. So I work on neurodegeneration, and neurodegenerative diseases include things like Alzheimer's disease, Parkinson's disease, ALS, Huntington's disease, as well as more rare diseases that you might not have heard of, like Pick's disease or familial British dementia. And essentially, the brain is a complex organ that grows through embryonic development and through our early decades. And then by our 20s, it's relatively fixed. In the sense that the cells that are there, the nerves that are there, are the ones that we're going to keep for the rest of our lives. So you can imagine that those neurons, those nerve cells that grow when you're a child, then have to live and survive and be maintained for decades and decades and decades out to people's 60s, 70s, and 80s. And they're highly specialized cells. They have, they're electrically active. So that's something different to other cells. They use a lot of ATP, a lot of energy. 20% of the body's energy is utilized in the brain. And then they have these amazing long axons and neurites, these processes by which they connect and form circuits through the brain and then, ultimately out into the body, into the peripheral nervous system. And then they have to be really long-lived. So there are these real kind of characteristics that are unique to the nerve cells. And the nerve cells are supported by astrocytes, microglia, oligodendrocytes, other cells in the brain that we thought were just support cells, but actually have a whole bunch of functions of their own. So you've got this kind of complex system in the brain. But you can imagine over time, there are repeated insults to the brain, whether it's environmental factors, whether there are genetic components, whether there are, metabolomic, lifestyle, different challenges, comorbidities, other diseases. And at some point, those nerve cells don't work in the way that they used to. And there are common ways in which those nerve cells break down, leading to degenerative processes. One of the most common things that happens in different neurodegenerative diseases is you get a defect in protein degradation and protein turnover. You get this aggregation of different types of proteins in the brain. In Alzheimer's, it's extracellular amyloid plaques, and it's intracellular tau neurofibrillary tangles. In Parkinson's disease, it's often aggregates of alpha-synuclein in Lewy bodies. In Huntington's disease, it's aggregates of these mutant Huntington proteins. So different things that go wrong, but some common themes about neurons breaking down, protein aggregates, neuroinflammation in response to that, neurodegeneration, ultimately leading to these symptoms of, different parts of the brain not functioning in the way that they previously did. So, in Parkinson's disease, the pathology is often, located in the substantia nigra and the striatum, which are regions that control movement, and you end up with a movement disorder. In Alzheimer's disease, one of the areas that is affected early is the hippocampus, and you end up with defects in patients' memory. So, that's kind of an overview of neurodegeneration, but essentially it's specific degenerative processes. It's not normal aging that lead to defective nerve cells, neurons in the brain, and ultimately different diseases depending on really the location of those problems in the brain.
Yeah, thank you. You did throw a lot of concepts. So hopefully it will make our listeners more curious to learn more about the hippocampus and the substantia nigra, which are all regions in the brain. So very well summarized. Thank you, Fiona. Now going into actual treatments, I'm curious, as a distinguished expert in neuroscience and a leader in the field of neurodegenerative diseases, I'm eager to hear your insights on the lack of effective treatments for neurodegenerative diseases like Parkinson's and Alzheimer's diseases. So while we celebrate the progress made very recently, where there have been some promising developments in recent years, such as drugs recently approved by the FDA that slow the progression of Alzheimer's disease, although that's true, the journey towards finding effective treatments remains a significant challenge, and neurodegenerative diseases like Parkinson's and Alzheimer's remain complex conditions without available cures that stop the disease. So although there are now treatments to slow it down, stopping seems to be very, very challenging. So from your perspective as a leading expert in neuroscience, why do you think it has been so challenging to develop effective treatments for these conditions of the brain? What steps can the scientific community take to accelerate progress in finding treatments or therapies? And ultimately, the goal is to help millions of patients and their families affected by these devastating diseases. What do we need to do?
Well, it's simple. It's because it's complicated. Like some of the challenges that we've had, the diseases go on behind the blood-brain barrier inside the skull. In psoriasis, you could take a skin biopsy and study the disease. In a rheumatoid arthritis, or even in different oncology, with different cancers, you can take a biopsy of the actual, disease process and study it. You can't take a brain biopsy. You can't study the disease that's as it's going on in someone's brain in real time. So really, one of the big challenges has been understanding the biological basis or the complexity of the disease. The second challenge from a drug discovery perspective is you're trying to get drugs inside the brain. The brain is protected by the blood-brain barrier. It's not a impervious barrier. We can get drugs inside, and either they diffuse inside and they have to have certain characteristics, or we can actively transport them inside the brain. But that's an additional challenge that you don't get for other therapeutic areas. And then all of these diseases are essentially slowly progressing diseases. Now we know they start decades before anyone has symptoms, and then over time you start to see these changes. For example, for a Parkinson's disease patient, by the time they show up in their movement disorder neurologist's office, they may have lost 50, 70% of the neurons in their substantia nigra. And then that's what you're trying to work with at that stage of diagnosis. And then we have slowly progressing diseases. A patient may be diagnosed with Alzheimer's, and then, they show slow progression over time. So to really test the efficacy of the therapies we bring forward in a clinical trial, we're talking hundreds of patients for a couple of years before we can see whether anything's working or not. So those are some of the challenges that we faced. But you're right, you can really look to the progress that's being made in Alzheimer's disease and ask, what's led to that? Why have we got to this place in Alzheimer's disease? What's changed, or what have we done in the field in order to get to this place? And I think there are some really clear examples of how different members of the field have worked together in order to make progress in the disease. So definitely progress in understanding the biological basis of disease. So for example, we talked last time about the genetics of disease, and that really pointing to some key factors causing disease in a subset of patients, but disease that could be, or mechanisms that could be relevant to a broader set of patients. So really understanding that biological basis of disease. And then actually advances in biomarkers, both the technology of biomarkers, either brain imaging with different PET scans, or blood-based biomarkers now, where you can simply take a plasma sample, measure specific proteins, and determine what's going on in somebody's brain and how soon they will progress or not to cognitive dysfunction and Alzheimer's in cognitive decline. Because of that scientific progress in Alzheimer's, applied to some amazing public-private partnerships and natural history studies like ADNI, Alzheimer's Disease Neuroimaging Initiative, natural history study looking at multiple biomarkers over decades in thousands of patients, or DIAN, Dominantly Inherited Alzheimer's Network, people who are going to get Alzheimer's because they've got mutations, studying those biomarkers for years before they get symptoms. Now we have a biological framework for disease, a way of diagnosing and measuring disease, and the ability to redefine the disease, not just as a clinical syndrome, but as a biological construct where we know when it starts, we know how we can measure it, we know the changes that happen. Because we've been able to do that, then that gives you a framework to actually go in with a therapeutic and specifically say, oh, this is my biological framework of disease. I can identify the patients, I can enroll them, I can interfere in this pathway, and I can measure the outcome. So that's really what has led to the transformation of the Alzheimer's disease field and this amazing point that we're at now, where we have one approved therapy, another that's likely to be approved, and multiple new exciting programs coming on behind.
Yeah, I agree. I like the summarizing what you just said, two main points. So understanding the biology, and you're right, that's what led to where we are today with genetics. That was a big push into doing that. And biomarkers. So I know it's a big, again, as someone that works in the field, I know it's a big discussion in the field if we are trying to intervene at the right time. So maybe we just need to diagnose earlier on, not when the neurons, the nerve cells, as you mentioned, have died, but if we go back and actually do something against the disease earlier on. So that's, and blood-based, just doing blood tests, that's very important. And I know there's a lot going on in the field. So that's amazing. Now, on a more general question on neuroscience specifically, looking ahead, what are your aspirations and goals for the future of neuroscience? What would you like to see happening in neuroscience in general?
I think in neurodegeneration, I'd really like there to be a shift in how we consider diseases of aging from, this is just normal aging, we're going to give them palliative care, to understanding the specific diseases and opportunities to intervene in those specific diseases. And then I think that also would precede this shift in middle age for people to be able to say, okay, I'm going to check my heart health with my cholesterol test. I'm going to check my brain health with this blood test that measures different brain proteins. And I'm going to be able to identify what I'm at risk for, where I may need to make lifestyle changes or therapeutic interventions to protect my health going forward. So really that shift towards brain health, like now I see we have a shift towards mental health being less stigmatized, for example. I also want us to see a shift towards general brain health and neurodegenerative brain health as being something that we see that we need to check in on and then look after, even in middle age. Because I think we're getting to a point where we're going to have ways that we can intervene and slow the progression, even maybe push out these diseases, beyond the scope of a normal life, to really protect people's brain health for the long term.
Yeah, I like that. And it's like when we think about exercise for heart health, but it has a big impact on brain. And on the other hand, we ignore things like stress or work environment, and they have such a big impact on our brain health. So that's very interesting.
Yeah.
Okay, so thank you, Dr. Elwood, for sharing your insights on the treatment of neurodegenerative diseases in neuroscience today. And thank you to our listeners for tuning in for today's episode. Make sure to check out last week's episode to hear more about Dr. Fiona Elwood and her career trajectory. She has a PhD. We'll be back soon. Until then, stay curious, stay inspired, and remember your power to have a positive impact on the world. See you soon.